Autism. Early signs. Introduction. Autism is a group of disorders with symptoms that range from mild to severe. Select true or false. Correct. That is why this disorder is referred to as autism spectrum disorder, or ASD. The earlier autism is diagnosed, the more likely the treatment will be successful. Select true or false. Correct. There is no cure for autism, but there are treatment options to help children with autism have a better quality of life. There is a cure for autism. Select true or false. Correct. Though there is no cure, healthcare providers have a variety of treatments and therapies to help children with autism help themselves as they grow older. Can healthcare providers tell the exact cause of autism in a child? Select yes or no. Correct. Scientists do not understand the exact cause of autism. Does every child who has at least 2 of the 10 most common signs of autism develop the disorder? Select true or false. Correct. A child may have 2 or more of the common signs of autism, but may just be developing slower than normal. The following are 2 behaviors of a child who is 16 months old. Which behavior suggests the child is not developing normally? Choose one of the following options. 1. The child does not use single words. 2. The child does not use 2-word phrases. Correct. At 16 months, a child should be using single words to communicate. The following are 2 behaviors of a child who is 22 months old. Which behavior suggests the child is not developing normally? Choose one of the following options. 1. The child used single words to communicate in the past, but has stopped. 2. The child does not use 2-word phrases. Correct. When a child loses any language or social skill that they used to have, it means that they are not developing normally. A child should be babbling and using gestures to communicate at 12 months old. Select true or false. Correct. Children usually use gestures and babble by the age of 12 months. Which of the following is a warning sign that a child may not be developing normally? Choose one of the following options. 1. At 4 months, a child is not using gestures. 2. At 24 months, a child is not using single words. Correct. At 24 months, children should be using single words and 2-word phrases. A child who is developing normally will begin using single words around the age of 16 months. Tom is 20 months old. He uses gestures and single words, but has not begun to use 2-word phrases. If Tom does not begin to use 2-word phrases by the time he is 24 months old, he is not developing normally. Select true or false. Correct. Is there a brain scan that lets healthcare providers tell for certain if a child has autism? Select yes or no. Correct. There is no single medical imaging test or lab test that can diagnose autism. Thank you for using Explain.